this or not? Could you hear me well? Yes. Buenas tardes, mi nombre es Cecilia Williams, soy miembro del Virginia Latino Advisory Board y soy encargada del Comité de Salud. Gobernador, yo soy feliz de vivir en Virginia, muy bendecida de vivir en este maravilloso estado. Usted ha manejado la pandemia muy bien. En el mes de junio del año pasado nos comunicamos con su oficina para informarle que el número de la comunidad latina, el número de contagios era desproporcionalmente alto. Inmediatamente usted tomó acción para ayudar a la comunidad latina. Mi trabajo como intérprete médico me permite ver todos los beneficios que usted brinda, no solo a los grupos minoritarios, sino también a todos los residentes del estado de Virginia. Es extremadamente importante que todos nos vacunemos, no solo para protegernos, para proteger a nuestros colegas, a nuestros amigos, a nuestra comunidad y, más importante, para proteger a nuestras familias. Yo digo a las personas que tienen miedo de la vacuna que le van a tener miedo a una vacuna que es efectiva y saludable o a un virus que es extremadamente peligroso y mortal. Cuanto más personas se vacunen, más rápido podemos volver a la normalidad y terminar este virus. Good afternoon. I want to acknowledge that this press conference is also available in Spanish on the Virginia Department of Emergency Management and the Facebook page. My name is Cecilia Williams, and I'm a board member of the Virginia Latino Advisory Board, and I serve in the Health Committee. I'm very happy to live in this beautiful state. Governor, your administration has managed the pandemic extremely well. Last June, we talked to your office about the disproportionately high number of COVID-19 cases among the Hispanic Latino community, and your office took action right away. My job as a medical interpreter allows me to learn all the benefits that you provide, not only to every single minority group in the Commonwealth, it's to everyone. It is extremely important that everyone gets the vaccine. We need to protect ourselves, protect our colleagues, our friends, our community, and most important, protect our families. I tell people that are hesitant to get the vaccine, what is worse, to worry about taking a safe and effective vaccine, or to worry about getting COVID-19, which is dangerous and a deadly virus? The sooner that everybody gets vaccinated, the sooner that we can end this pandemic. And now, it's my great honor and pleasure to introduce to all of you Dr. Ralph Northam, the 73rd Governor of the Commonwealth of Virginia.
Well, good afternoon to everybody, and to Cecilia, thank you for your kind introduction, and thank you for all your work with the Latino Advisory Board. I want to thank all of you for joining us today, and to everyone that's watching live from elsewhere. I'd like to echo Cecilia in noting that this press conference, like all of our COVID updates, are also broadcast in Spanish on the Virginia Department of Emergency Management's Facebook page. I also would like to welcome Senator Mark Warner and Congressman Don Beyer, Chairman Jeff McKay, for all of their great teamwork. This has been a collaborative effort from the beginning at the local, state, and federal level, and we wouldn't be here where we are today in Virginia without all of their assistance. I want to also thank everyone that's here in Fairfax and with the Virginia Department of Emergency Management and the Department of Health, who have put this new mass vaccination clinic together. There are also thanks to all of our volunteers. And one person, there are a lot of people that need to be acknowledged, but one person that has really been instrumental throughout this vaccination rollout is here today. He needs no introduction. You've seen him before the cameras, but that's Dr. Danny Avula, who was with the City of Richmond and Henrico County Department of Health and has really stepped up and done a phenomenal job. So, Dr. Avula, thank you very much for all of your work. We are here today to talk about some really good news. As of yesterday, every adult in Virginia is now eligible to get a COVID vaccine. Over the past 4 months, we have made tremendous progress vaccinating Virginians against the COVID-19 virus. This has been a very tough year for everyone, and Virginians have done an outstanding job following the guidelines to keep our cases and deaths lower than almost all other states in this country. We know that this vaccination process is our path towards saving lives and ending this pandemic. It is literally the light and the hope at the end of a long, dark tunnel. Today, about half of the adults in Virginia have had at least their first dose of the vaccine. That's more than 39% of all Virginians, and almost 25% are fully vaccinated. We focused on saving lives, which is why we started back in December with those most at risk of serious illness or death. Priority groups included people in nursing homes, those over age 65, people who have medical conditions that make them more vulnerable, and frontline essential workers. Many health districts have gone through the priority groups on their pre-registration list and reached out to everyone with an invitation to get vaccinated. Now we're moving forward. The Commonwealth has now entered an exciting new phase of our COVID-19 vaccination program. Everyone, I want to repeat that, everyone age 16 and older statewide is now eligible to be vaccinated. And I hope and I recommend that everyone take advantage of that. Now, it may take a few weeks to get appointments for everyone. We estimate at least 3 million more Virginians are now eligible. Not everyone can get a shot today or even this week. And while demand still outstrips supply, our supply is much larger than it used to be. So today, our message is simple. If you're an adult, you should get a shot. If you're older, you should get a shot. If you're in your 20s or 30s, you can get COVID too. You should get a shot. Working with our partners in local health districts, private pharmacy chains, doctors' offices, and others, I'm confident that every adult in Virginia who wants the vaccine can get their first shot by the end of May. As we move into the next phase of the vaccination rollout, our scheduling system is shifting as well. You'll still need an appointment for most vaccinations, but you'll be able to schedule your own appointment, whether it's at a mass clinic like this one, or your local pharmacy, or through a hospital. You can go to vaccine.virginia.gov, the same pre-registration site we've been using all along. There you'll see a button to schedule an appointment. That will take you to the CDC's Vaccine Finder tool, which will show you all the options near you. You can also continue to call the hotline, 877-FACTS in Virginia, or as I like to convert, 877-829-4682. And I'll remind you that that call center is in both English and Spanish and available in about 100 other languages. So here's what I want to emphasize today. However you're able to get an appointment, please get vaccinated. It will keep you safer, it will keep your family safer, and it will keep your community safer. Vaccinations are the only way we can end this pandemic and get back to normal. The risk of getting seriously ill if you get COVID they're just too high. We need to stop the circulation of this virus and stop its chances to mutate. That's what vaccines will do, protect us now and end this pandemic more quickly so we can all get back to a more normal way of life. And that's what we all want. We're not quite there yet. After dropping steeply earlier this year, our daily case counts have been on a relative plateau for the past month or so. I'm glad to say we had fewer than 1,000 new cases reported from yesterday, 978 to be exact. And our percent positivity is down to 6.1%. We're making a few small tweaks to guidelines. We'll have more to say that in the coming weeks. And just a couple of those real quickly. Cross country will be allowed to have 68 runners at the starting line, which is up from 50. I've heard a lot of discussion about that. Thank you for that back there. Currently, performance events like drama and musicals are considered social gatherings. I've heard a lot of feedback from parents and students that these events should be treated the same as athletic events, and I agree. So we'll increase the number of people to 100 indoors, or 30% of that venue's capacity. If it's outdoors, it will be increased to 500, or 30% of capacity. I continue, as I have always said, to monitor the data, and we'll have further updates in the coming days. But we all need to remember that this virus is still circulating. People are still getting sick, and unfortunately, people are still dying. I just want to remind people, on a somber note, this Commonwealth has lost over 10,000 Virginians to COVID-19. The variants, which we have talked about, which are more contagious, are here in Virginia as well. So, please, this is no time for Virginia to let down our guard. We all need to keep wearing a mask in public. We need to keep our distance. We need to keep washing our hands, and if we feel sick, we need to stay at home. We need to do that to give more time for people to get vaccinated. We're on the right track. We just need to keep being careful and vigilant. Again, I want to thank everyone who has worked to create this clinic and all of you here today. As you will probably hear more as you hear from our other speakers, this clinic is equipped to do 3,000 vaccinations a day for as long as we need to be here. So without further ado, you're going to hear from a number of other individuals, but I'm going to start with our senior senator, a former governor of the Commonwealth of Virginia. And I do want to just reiterate that we are in a position in Virginia today. Our first case, believe it or not, was March 7th of 2020. And we're here today because people have worked together. Our elected officials, our public servants, whether they be at the local, state, or federal level, we communicate often, and I can't say enough about the cooperation and the collaboration that we've had in Virginia. So I welcome to the podium our 69th governor of the Commonwealth of Virginia, His Excellency, Senator Mark Warner. Mark.
Thank you. Well, thank you, Governor. Thank you for your leadership. We are very lucky in the Commonwealth to have you as governor at this moment in time. And let me remind everyone, we also have the only doctor governor during the period of COVID, and that leadership is exemplified. Let me just also say to this clinic, I know it is a combination between our friends at Ashbridge and VDM and IEM, and it really is a collaborative approach. I think people will see when it opens tomorrow. People will be able to get through in a smooth way. We all know in Northern Virginia we have folks from a lot of different backgrounds. As we were going through, not only will visitors be able to interact with people in English, Spanish, a few other key languages, but Mark, if somebody goes beyond those languages, they've got a machine over there where you can pick by language, and we drew up a Croatian interpreter, and there was someone who popped up on the screen and started talking to Croatian to me. Don Beyer translated, but it was, again, I think a show that we can take on anybody that's coming on. I want to reemphasize what the governor said. If you haven't got a shot, get a shot. This is not a question of politics. It's not a question of who you like or don't like for president. It's about whether you care about yourself, your family, your neighbors, your community. We are 57 weeks since the first shutdown occurred. I don't think any of us, when we started this, 13 plus months ago, thought we'd be still standing here, near the end of April 2021, urging people to go ahead and finish out becoming protected. The governor mentioned the number of Virginians, number of Americans. We've lost over 575,000 Americans have died. And as we see from some of the reports, this is a global pandemic. We see, thank God, in America things are leveling off and coming down. But in many countries around the world, those numbers are still going up. So it is absolutely critical that we reach out to all our fellow Virginians, urge them to come down here. This is free. There will be people who will speak your language. There will be other sites around Northern Virginia. Do it for yourself. Do it for your loved ones. Do it so that we can return to normal. It has been a remarkable year, the governor mentioned, and I am proud of the fact that for the most part, the $5 trillion, that's with a T, $5 trillion the federal government has invested in COVID-related relief. I think history will look back and say, well, some of it may have been excessive, that but for those actions, we wouldn't have an economy that's on the verge of coming back in a dramatic way. My hope is that at some point in the not-too-distant future, this facility, which is a vaccination site today, can convert back to a retail store. Well, to get that ability to have that conversion back, we've all got to be safe. I want to particularly point out as well, I mentioned this to the governor, but I figured you've got a member of the legislature here, Markeem. The U.S. feds in the last bill sent $4 billion to the Commonwealth of Virginia. $3 billion of that also went directly. Another $3 billion on top of that went to local governments across the Commonwealth of Virginia. Those dollars come without many strings. We've put a couple $100 million as well into the Fairfax County schools. Each local school division got additional funding. My only counsel is use it well. God willing, that will be the last of the COVID relief packages. But there are so many things, from broadband deployment to making sure businesses get back on their feet, to making sure that our kids get back into schools in ways where they can learn appropriately and efficiently. And Governor, for all that you have done and will continue to do, and to your colleagues at the local government level, Jeff McKay, and all the Fairfax County Board, Dahlia and others, thank you. We are on the verge of getting this virus licked. But it is really going to be up to all of us to make sure that we all get this vaccination so we can have COVID in the rearview mirror, look back on the 57 plus weeks of shutdown and restrictions on life, but we will not get there until we finish this process. Let me bring up my partner, my congressman, somebody who has served as well at the state level, our great former lieutenant governor and now congressman from the 8th District, Don Beyer.
Thank you, Senator, very much. I'm so excited to be here. We've been pushing for quite a long time to have a mass vaccination site in Northern Virginia, and now it's here. It takes a lot of work and coordination to make this happen. I really want to thank the governor and his team, the Virginia Health Department, as well as Jeff McKay and everyone from Fairfax County and the Fairfax Health Department who's made this happen. Senator Warner talked about us having the only physician governor in America. We also have probably the only governor who met with the entire federal delegation every Thursday night for the last 57 weeks for an hour and a half to get everything out of the federal government that he possibly could, and also letting us know what needed to happen. And I'm so thrilled too that all the leadership that Mark Warner gave to get these bills to the Senate. You know, the House works on a simple majority. We could pass the bills. Getting them through the Senate is a miracle. But he was able to get $5 trillion for all of us to do that. By the way, this may be the last tranche of COVID relief, but Governor, we have infrastructure money coming, which will be wonderful. You know, as Mark and Ralph have both said, getting vaccinated is the single most important thing that you can do. I chair the Joint Economic Committee, which is bipartisan, and we've been talking to the nation's top economists now for a year. Every single one across the political spectrum has said the single most important thing, the only way we can get this economy open again is to kill the virus, to defeat it. And as we know, the most effective way to defeat the virus is for every single one of us to get vaccinated. That's why the country took on this incredible vaccination program, the equivalent of taking people to the moon or the Manhattan Project. We've done all this through the CARES Act, to the American Rescue Plan, and now it's incumbent on every member of our citizenry in Northern Virginia to come take advantage of this amazing site. I think Jeff McKay suggested that many hundreds of thousands of people unvaccinated have just become eligible in the last couple of days. This vaccination site, which I hope we never need again in the rest of our lives, is here for us now. And it's essential that if you love your wife, if you love your children, you love your husband, you love your community, get vaccinated as soon as you possibly can. And with that, let me introduce one of the most important people in this process, a health navigator, who will help all of us in whatever language we need. By the way, I can only do the Croatian because it was so close to the Slovenian. Is Kevin Hahn from Noviskak, who is a health navigator in both English and Korean. Kevin, the floor is yours.
Thank you, Congressman, and good afternoon. My name is Kevin Hahn, and I serve as the health navigator at Nagasaki, Virginia. I have seen firsthand the detrimental impact of COVID-19 on Virginia's communities, including the Asian American and Pacific Islander community. That's why I'm here today. I'm standing with the governor to encourage everyone living in Virginia to get vaccinated. Visit vaccinate.virginia.gov or call 877-VAX-NVA for more information. The call center is equipped to address questions in more than 100 languages. Please do not wait. Virginia's health is still in our hands. Get vaccinated. 네, 안녕하세요. 제 이름은 케빈 한입니다. 저는 나크색으로 불리는 미교협 버지니아 지부에서 건강 관련 안내자도 봉사하고 있습니다. 저는 이번 COVID-19 바이러스가 아시아 태평양 지역사회들 포함해 버지니아 지역사회에 극히 해롭고 위험한 영향을 미치는 것을 직접 목격했습니다. 그 때문에 제가 오늘 여기에 서 있는 거입니다. 저는 버지니아 주민들이면 모두 백신 접종하려도 권장하고 계신 주지사들 전폭 지지합니다. 더 많은 정보를 얻으시려면 웹사이트인 vaccinate.virginia.gov를 방문하거나 877-VAX-NVA 877-829-4682도 전화해주세요. 콜센터는 100개 이상의 언어도 답변할 수 있도록 준비되어 있습니다. 제발 뒤도 미루지 마십시오. 버지니아 건강은 우리 손에 달려 있습니다. 백신을 접종하세요. 감사합니다. Now I'd like to introduce Chairman Jeff McKay.
Good afternoon, everyone. I am Jeff McKay, Chairman of the Fairfax County Board of Supervisors, and I want to thank all of you for coming out today and helping us push these important messages out. First, I want to thank the Governor for all of his work at the Commonwealth of Virginia level to help us defeat this virus. I also want to thank our congressional delegation, specifically Congressman Beyer, Senator Mark Warner, who led the fight to get federal support to help us through this pandemic. And it's not just federal money, it's life-changing money. It's money that we put in to save our small businesses. It's money that went directly to our nonprofits to provide emergency shelter and to pay utility bills for people who are struggling. It's money who went forward to help our first responders. Money that's helped us set up clinics like the one we're celebrating today. This is essential financial support that is necessary for counties to get through this pandemic. But I stand here today not only as chairman of the board, but as the president of the Virginia Association of Counties, and I can tell you, everywhere in Virginia, this federal support is helping our counties every day defeat this virus. As we enter phase 2, by order of magnitude, to share some numbers with you, in Fairfax County, we have administered over 700,000 doses of vaccine since this pandemic began. And in phase 2, we now know that roughly 500,000 people have become eligible just in Fairfax County to get vaccinated. That's why these partnerships like the one we're celebrating today are so important. It takes our state partners, it takes our federal partners, it takes our local government, but it also takes generous folks in Fairfax County. Generous folks like Macerich, who owns Tyson's Corner, who provided this space today, to the dozens and really hundreds of businesses who have come forward to help support us in Fairfax County deliver services and vaccines to people across the county. This is one clinic that can process up to 3,000 folks a day, but it is one of many places in Fairfax County where people can get vaccinated. At a very local level, through our community partners, or through major centers like this one that can vaccinate a lot of people very quickly. The most important thing for us is to open up as many centers, make them available to as many people as possible, and make it easy for people to get vaccinated. We know that we still have challenges with supply. What we don't have a challenge with in Fairfax County is having centers like this that no matter how many vaccines we get on a weekly basis, we can ensure the logistics are in place that get them into the arms of people in Fairfax County to, again, get us back to a level of normal. This is symbolic that we are here in Tyson's Corner today. This is the economic engine of Fairfax County, the economic engine, frankly, of the Commonwealth of Virginia, and it is necessary that people in Fairfax County get vaccinated. I always share with people my own perspective of getting vaccinated is that this is an act of charity. And in Fairfax County, we are charitable people. We believe not only in protecting ourselves, but more importantly, in most cases, protecting everyone around us. The folks we interact with in a grocery store, the teachers in our kids' schools, the people who are working in our nonprofits, our first responders, everyone that you interact with on a daily basis. Do this for all of them, not just for yourselves. Do it as an act of charity so that we can defeat this virus and get through this struggle that we currently face. Please go to vaccinefinder.org, go to the state webpage, look at the options that are available to get vaccinated, but most importantly, two things. One, remain patient. We will get everyone in Fairfax County who wants to get vaccinated, period. We might not be able to do it as quickly as everyone like, but we will get to everyone. So please be patient as supply becomes available. And to stress again what so many others have stressed, we must win this marathon. And the only way to do it is to continue to be vigilant. It's to wear masks, it's to wash your hands, it's to distance yourself from folks and do the things that have been being stressed for the last year. We have come too far to let our guard down at this point. And with centers like this opening, there's tremendous light at the end of the tunnel that we will get to vaccinate every single person. Now it's up to the people in Fairfax County and the Commonwealth of Virginia to register and get vaccinated, take their act of charity to protect everyone. So thank you all for coming today. I know we look forward to some questions, but appreciate everyone coming today and appreciate everyone raising awareness to all residents in the Commonwealth of Virginia about the importance of facilities like this and the importance of getting vaccinated. Thank you.
Absolutely. I would answer your question. I'm going to let Dr. Avula, because he's in charge of our allotment and distribution. So, Danny, thank you for being with us.
The question was, what is the federal government telling us about upcoming supply with Johnson & Johnson not being able to be used right now? Well, first, the Advisory Committee on Immunization Practice will be meeting on Friday for a decision about whether we move forward with Johnson & Johnson or not. The CDC and FDA continue to gather data, and ultimately the ACIP will make a determination. But in lieu of that, this week we have received an additional 15,000 first doses of Moderna and Pfizer to come to a total of 220,000 first doses coming into the state this week. And then it sounds like our Moderna and Pfizer, the production capability is kind of maxed out. So we don't expect there to be a significant increase in Moderna and Pfizer moving forward. We'll continue to get the total allotment we've been receiving, which is about 450 to 500,000 total doses of Moderna and Pfizer. And hopefully we'll have good news with Johnson & Johnson, which would increase that by probably another 100,000 doses next week.
Well, I think your question is right on, and it's certainly something that we're focused on, not only young people, but those in neighborhoods that are lesser served. And if you remember back when this vaccination rollout started, we really were focused on the most vulnerable, those in long-term care facilities, the elderly, and those that had medical conditions. So the way we reach out to young people is through events like this, through our community leaders, through our faith leaders in various communities, and again, just make them realize that, as I think Jeff said it very eloquently, that this is a way of not only protecting themselves, but also taking a mission to protect their neighbors, their friends, their families. And in order to reach herd immunity, which is about 70 to 75% of the population, they have to be a part of that. I think just to dovetail into your question, there are ongoing trials with our youth right now. The data, and we have reviewed the data from Pfizer of 12 and above, and I anticipate getting approval from the FDA, hopefully in the next few weeks to a month. So that will take care of the 12 and above. We still have those that are younger, and so we're anxiously awaiting. There are ongoing trials. We hope that those show that these vaccinations vaccines are safe and effective, and we can get a great majority of them vaccinated as well, because in order to get to that 70 to 75%, we need the entire population, and we have about 8.5 million Virginians. So we're going to encourage everybody to get vaccinated.
The next question is from Bill Atkinson with the Progress Petersburg Index.
Thank you, Elena. Governor, my question pertains to what you mentioned earlier about the additional 3 million Virginians being added to the roster to be able to get their shots as a result of opening it up today. And you mentioned how the time frame said it may not be today, may not be this week, next week, may take a few weeks. How much of that is dependent upon how quickly we can get the Johnson & Johnson vaccine back into circulation, or is it that few weeks and months adding on the extra people?
It's a great question, and obviously the more vaccines we have available, the quicker we can get to getting everybody vaccinated. But the allotment that we're getting for both the Moderna and the Pfizer will allow us to, I believe, comfortably get all of adults vaccinated by mid to late May, and then after that we'll move on to our children. But I think that we're in a good position as long as the allotment continues. Something that I'm very proud of, and it's just great being in this facility right here at Tyson's. We have the infrastructure, we have the systems in place, we have volunteers, and to all of you across Virginia that have volunteered as part of this rollout, I say thank you on behalf of Virginia. But the system is in place. We're just dependent on the amount of supply that we get right now, and if it continues, again, our goal is to vaccinate all adults by the end of May.
Question for Chairman McKay and Dr. Lewis. Chairman, you and the other regional leaders not long ago wrote a letter to the governor and
Let me start and say that we have conversations with the administration, with Virginia Department of Health leaders every week, stressing what is on the ground happening in Fairfax County. We are blessed with a population that wants to get vaccinated, and we have made that clear. We know that demand is outstripping supply. It really has since the beginning. And so what we try to do is obviously lobby to get as many vaccines as we can in an equitable way to Fairfax County, make sure that we point out that we have vulnerable populations in the county that are underserved, that we would need to get vaccinated as well. But it's on a week-to-week basis. There's fluctuation, and it comes down to what the Commonwealth gets and how that gets distributed out to the counties. But as you can see here, when we can vaccinate 3,000 people a day just at this facility, you can do the numbers and determine, take this, plus all the other facilities we have across the county, we can ramp up and vaccinate thousands and thousands and thousands of more people if the vaccine becomes available. But the state, of course, is challenged with the supply coming into them. What I want to make certain of is what I can control. And what I can control is making sure that we have these facilities and infrastructure in place so that no matter how many vaccines I get on a given week, what I can guarantee the Commonwealth is no matter how many we get, those will go into arms of people that week because we can scale up that quickly.
Dr. Phillips, following up on that, you've talked before about reallocation, moving doses maybe away from health districts where they're not being used quite quickly. Can you actually walk through how often that happens, how many doses are we talking about, and how many more can come up this way on any given day?
Yeah, you know, I think one of the things that has been really surprising in the rollout of this vaccination effort is how quickly demand has dropped off in different parts of the state. I mean, we knew that there was going to be a difference in the demand in places like Northern Virginia versus more rural Virginia, but it's been pretty stark. And I think actually that probably describes the next phase of our work is really figuring out how do we get to those places of low demand and do the hard work to increase access and to help people understand why they should still be vaccinated. And so many of the folks up here have said, you know, this is not political. This is about, do you want to keep yourself and your family and your community safe and help us progress, you know, economically and socially moving forward. So that's the next phase of the work over the next couple of months. But it is happening every week. I mean, every week we're seeing demand drop off in certain communities. We're shifting that to Northern Virginia, to the Charlottesville area, to the Richmond area where we're still seeing demand. And so we are consistently making those tweaks to give a scale. This past week it was about 40,000 doses that went unordered in other parts of the state that we then really shifted primarily to Northern Virginia and then to some of those other areas.
The next question is from Jackie D'Acusco with WRIP.
About 40,000 businesses that went on. Hi, I am wondering if you can speak to the most optimistic timeline for reaching herd immunity versus what the likely timeline might be. And then also, we're hearing some limited reports of undocumented immigrants being turned away at pharmacies because they are not having a legal form of identification. So has there been any formal guidance from the state on how pharmacies should handle those situations to make sure that group is getting vaccinated as well?
Yes, I'll answer the second part of your question first. If there's anybody that is undocumented that has shown up to a clinic, a pharmacy, whatever, and is being turned away, that should not be happening, and I would like it brought to our attention. So I would encourage those that are watching, if you have had that experience, please call our call center, our hotline, and we will remedy that situation. As far as your, what I would call a crystal ball, when will we reach herd immunity? We're getting closer every day, and the more adults that will come into sites like this and be vaccinated, the sooner we'll get there. My comments earlier, we have 8.5 million Virginians. Between 2 and 2.5 million of those are children. So if you do the math and say we need to get 70 to 75%, we have to have our children vaccinated as well. So as I said earlier, there are ongoing trials. I anticipate hopefully hearing from the FDA this summer. We can start 12 and above, and then other trials will be announced and approved by the FDA hopefully after that time. So, you know, we're looking at least this fall and winter, and, you know, hopefully certainly by 2022, the beginning of 2022, we'll be much closer to herd immunity. I will tell you, though, one of the reasons we I don't want to sound like a broken record, but the reason that we need people to get vaccinated is because we'll never get to herd immunity if we don't get shots in arms. And what we are concerned about, this virus is smart. It needs vectors like us to live. And if there are vectors out there, it will live and it will also mutate. And it will become more of a challenge regarding vaccinations. And so the sooner that we can get people vaccinated, the better, and the sooner we'll get to herd immunity.
Governor, about the vaccine finder website, apparently some pharmacies in Fairfax County and surrounding jurisdictions have been telling people that Virginia is still in phase 1. That and the fact that the site is in English frustrates people that are trying to get their appointments made. When will the entire vaccine finder website be brought up to speed for Virginia? And do you know whether the CDC plans to make appointments available in Spanish, Korean, and other languages that remain
You got a couple things woven into your question. I'm not aware of individuals that have been told that we're still in phase 1, but again, if there are out there, we will work as hard as we can to get that message out there, because as of yesterday, April the 18th, everybody in Virginia is in phase 2 and everybody is eligible, 16 and above, to be vaccinated. Could you elaborate on your question about the different languages?
It seems that the website is only in English, and I'm just wondering if are there plans for Spanish and other languages?
Yeah, the question is, are there plans for Vaccine Finder to be translated into other languages to make it more accessible? Vaccine Finder is a federal website. It was created by the CDC, and it's kind of an aggregator site. So anybody who has available appointments ends up with a link on vaccinefinder.org. What we have done, we've kind of built that into the vaccinate.virginia.gov website, which is translatable into Spanish, but we've also made it fully accessible and navigable through our state call center. So anybody who has language needs, we would really urge to call 1-877-VACCINE-VA. About 10% of our agents are bilingual English-Spanish, and then you can get a call back in one of 100 different languages. And those agents, we actually increased the number of agents by 250 additional agents to manage the expected increase in volume this week. And we know that there are going to be more people who need help navigating the vaccinefinder.org. So we'll take the question to the CDC to see if there is a timeline for translation for the Vaccine Finder site. We also are looking at other ways to get direct access that doesn't have to go through Vaccine Finder so that we can address some of those language barriers.
Yeah, I just want to add one thing for clarity that might be part of the confusion. Here in Fairfax County, we still have people who are on a wait list in phase 1. And so what we have been messaging out to people is we are in phase 2, which means everyone is eligible, as been mentioned here, but we're going to prioritize vaccinating people who are already registered in phase 1 until that entire wait list has been exhausted. At that point in time, we'll more aggressively be vaccinating people who are in phase 2. And so that might be part of the confusion. But because you're eligible, you can still go to the web page. You can still sign up for an appointment. But we want to make sure we get those phase 1 people who have been in our queue waiting vaccinated before we start opening it up to phase 2 people at the Fairfax County Health Controlled Clinics. And so that might be part of the confusion. I just wanted to add that.
We got time for one more from the phone from Tracy Agnew with the Suffolk News Herald.
Hi, this is Jimmy LaRue with the Suffolk News Herald. Can you provide an update just on, especially now with the P1 variant making its presence in Virginia, at least finding out about that, can you provide an update on the surveillance of the variant across the state and an update on the surveying of those variants and how much is currently being done?
Yeah, thanks, Jeremy. So the question is, with the announcement that we now have P1 in Virginia, there was a press release at the end of last week that the P1, which is the Brazilian variant, was found in 2 different parts of the state, one where there was a clear travel history, one where there was not. And I think that is just further evidence that these variants are circulating. The B117 variant, which is the UK variant, currently makes up 44% of new cases across the country. And so we do need to increase the amount of genetic surveillance that we're doing here in Virginia so we can get a better sense of what what's happening here in the state. Currently, about 15% of our cases that come into the state lab are being sequenced, and new federal funding is being directed to that to increase the capacity of the state labs. DCLS is working with other partners around the state, some other academic institutions and their labs to increase our surveillance capabilities. And then in addition to that, the CDC is also contracting with folks like LabCorp and Quest Diagnostics to be able to add genetic sequencing outside of just the samples that come through the state lab. And so I think in the next few weeks, we've been doing about 15%. That will expand significantly, so we'll have more clarity about the degree to which we're seeing circulating variants here in the Commonwealth.
Thank you. Thank you. We're going to need to wrap up, so Governor, get a closing remark.
No, again, just thanks to everybody for being here today. Again, thanks for all the folks that have helped to put this clinic together. And I just wanted to thank also the press. This is a team effort, as I said earlier. We do our best to give the most accurate and updated information to our fellow Virginians, and you are a part of a very important team. So thank you. Again, encourage everybody to stay safe, stay healthy, sign up, get your appointment, and when it's your turn, please get vaccinated. That's the way we'll put this pandemic behind us. So thanks to all of you for being here. Appreciate it.